92 here in Brisbane. And I'm pleased this year we top the number of delegates. We certainly beat Victoria from last year, and as a Queenslander, I'm pretty happy about that. Sorry, the Victorians in the audience. But it's great to see so many delegates here. You are always welcome in our city. We are a very welcoming city and state, and for no matter where you're from our nation or from around the world, you will find a welcome place in our city. And I'm so excited that this conference, the largest health informatics, digital health and e-health event in Australia, is being held in Brisbane this year. As you know, the theme of this year's conference is Driving Reform. Digital health is everyone's business. Reform in digital health is something that is a subject that I'm very interested in. It's something I'm vitally interested in because of the important role information technology plays in the delivery of health services in a very large, diverse and decentralised state like Queensland. Our issues here are familiar all over the world. We have an ageing population who will have a greater call on the health system in future. So we need to find new and better ways of delivering health services. Along with the stellar array of interstate and international guest speakers and panellists, I hope you have a chance to talk and hear from some of the excellent people from our state over the next 3 days. Queensland Health has long been an enthusiastic participant in this conference, and we are delighted to be HIC 2015's state partner. It's a given that health informatics is an integral part of achieving a modern, effective health system. Global healthcare models are continuing to evolve in complexity and in sophistication. The focus today is very much on accountable health management, delivering patient-centric and alternative models of care as close to home as possible. Along with evolving clinical practices and advances in biomedical technologies, these forces are driving the demand for more and better digital services in health. The government, of which I'm proud to be a member, recognises the importance of e-health as a policy priority in supporting a better quality of health for all Queenslanders. And at Queensland Health, our primary focus is on patient outcomes. Our aim is to put the patient first. One of the ways we can better do this is by innovative use of digital technology to support our clinicians delivering frontline health services. In this spirit, Queensland Health is combining the agencies of the Health Services Information Agency and the Office of the Chief Health Information Officer to form a single, strong agency called eHealth Queensland. We believe that having our strategic and operational information technology leadership in one agency will better enable us to achieve our eHealth goals. We're committed to a fully integrated health system with a mobile workforce that can access information as quickly and as close to the patient as possible. Our eHealth investment priorities include contemporary network and data centre foundations, a contemporary desktop environment to support a consistent user experience, a secure environment to share information and images and to consult with others through an information interoperability platform, and a statewide electronic medical record system that enables digital hospitals. We are implementing an integrated electronic medical record solution, IEMR, in staged releases at selected state hospitals. That solution supports, amongst other things, order entry, pathology and radiology results, reporting, clinical documentation, alerts and algaes, and very importantly, discharge summaries. Transitioning from paper to electronic patient clinical records provides timely access to relevant information to support clinical decision-making at the point of care. The net result is improved clinical capability, improved quality of care and reduced patient risk. The government's also implementing a statewide patient information viewing solution called the Viewer. The viewer provides Queensland health clinicians with faster access to comprehensive current patient information in one place. Queensland has the largest number of hospitals connected to the personally controlled electronic health record system, with statewide viewing ability enabled through the viewer. The majority of our hospitals send electronic discharge summaries to this system. Queensland is also recognised as a leader in the adoption of national e-health standards, solutions and infrastructure. Queensland Health recently launched an e-health architecture vision which will form the basis for development of our technology roadmap. It will service our clinicians, consumers and administrators across the healthcare system, delivering quality information and better health outcomes for patients. And for those interested, the e-health architecture vision is available at the Queensland Health Expo booth. I want to say a little bit about telehealth now, if I can. As many of you know, Australia is a very big country and Queensland is a very big state. Later this week I will fly to Darwin, a flight of about 4 hours from Brisbane. 3 of those 4 hours will be over Queensland. Queensland is in fact 5 times the size of Japan, 7 times the size of Great Britain, and my favourite, 2.5 times the size of Texas. As a consequence, we face bigger challenges than most parts of the world in providing healthcare to places which are a long way from anywhere else. It's why I'm particularly interested in telehealth. Telehealth, as many of you know, plays a key role in enabling access to safe and sustainable care for rural and remote communities in particular. Queensland currently has one of the largest managed telehealth networks in Australia, with over 2,000 systems deployed in over 200 hospitals and community facilities. The networks support more than 40 clinical specialties and subspecialties across our state. I saw this in operation myself in Mount Isa when I was connected through the telehealth system on an iPad to our clinic in Mornington Island, which is in the Gulf of Carpentaria. So you can be in the ED department at Mount Isa Hospital and connect through telehealth on the iPad to the health clinic and the staff there at Mornington Island. And that's the future. We will, I think, jump a generation of technology, and ultimately we will be having that connection with patients in their home across the internet, which I know didn't exist, I think, was in its very, very early stages 22 years ago when the conference first started in Brisbane. In the future, specialists with their allied health specialists, with their nursing support, it will happen over the internet, from their home, on the technology, in many ways that wasn't even contemplated 22 years ago when this conference was first held in Brisbane. So it's clear that there are a lot of exciting things going on in health informatics in Queensland, and in Queensland, not just in Queensland Health, but across our state as a whole, with lots more to come. You certainly have a great deal to discuss this week. I'd like to thank you for attending HIC 2015, and I hope your time here is both interesting, stimulating, and perhaps most of all, enjoyable. Thank you and enjoy the conference.